Psychedelic Today podcast with David Drapkin and our guest, Dr. Rick Barnett. Lovely to see you, Rick. How are you doing?
Excellent. Nice to see you.
Yeah, it's been a long time coming, and we've had virtual interactions, and I guess this is another virtual one, but I'm really looking forward to digging into quite a few topics today. So I hope you're ready for a diverse conversation.
I am. I'm delighted to be invited to be on the show, and hopefully can add value. There's lots of topics to cover, and I love having really good conversations with people about all kinds of things related to psychedelics, addiction, recovery, mental health. So I'm happy to dive in.
Beautiful. All right, so before we dive, I want to let our viewers know that Dr. Rick Barnett is a licensed clinical psychologist, and one of the things that I'm a big fan of, Rick, is your authenticity. So your realness and your kind of, just cutting through the crap a little bit and saying this is important, but also doing it in a loving way, and the warmth that you share. And so I want to kind of honor you for that just to begin with. I really appreciate that. And can you tell us a bit more about yourself, Rick? So if you want to introduce yourself to some of our listeners that perhaps don't know who you are yet.
Sure. Yeah. I'm a licensed clinical psychologist. Most of my work is done on the front lines of clinical counseling, mental health, psychotherapy, addiction counseling. That's my day in and day out. I've been doing that officially as a licensed psychologist since 2004. So coming up on 20 years. And prior to that, I'm a person in long-term recovery from addiction. So I have a personal history of, misusing massive amounts of alcohol and other drugs as a kid, basically from the age of 10 to 20, starting with nicotine, tobacco at the age of 10, and then just progressing to the point where I got pretty physically sick, got into some serious legal situations and some very strained family and social situations, unfortunately. And but luckily was given the gift of recovery and sobriety, and was able to go back to school and get my finish my bachelor's degree, get a master's degree, get a doctoral degree, get another master's degree. It became somewhat of a school junkie after that for a while. I love learning. I'm continuing to learn. It's one of the reasons why I came back to psychedelics, to taking the training through the California Institute of Integral Studies. They have a fantastic training program for psychedelic research and psychedelic therapy. So I was fortunate enough to do that in 2020. And I'm still learning. I'm a lifelong learner, and listening to Psychedelics Today and learning from the folks that you guys have on your podcast is one of those resources for me. So that's a little bit about who I am. I'm also an outdoor enthusiast. I'm a little bit of an adrenaline junkie. Love to do fun stuff and travel. So that's a little bit about me.
Beautiful. Yeah, I've seen some pictures of you hiking and being with your dog in the mountains of Vermont.
Yeah. Love Vermont. Vermont's my home state. I did spend 13 years in New York City, which I love New York City, and I met a lot of cool people. I went to I finished my undergraduate at Columbia there. I went to Yeshiva University for my doctorate. Worked at Mount Sinai Medical Center in their outpatient alcohol and drug program. Worked at the Hazelden Foundation. They had a halfway house and an outpatient program in Manhattan. So I love Manhattan, love New York City, but I'm a country boy by heart, and I love being in the mountains.
I've never been to Vermont, Rick, but I know there's huge mountains there. Can you maybe just paint a picture of what it feels like to you, especially someone that's been in Manhattan? What's it like up there? Just as life settles down in the mountains of Vermont.
Yeah, I mean, the contrast between New York City and where I live in Vermont couldn't be more significant. Extremely rural here. I live in a town of 5,000 people, and it's the town that I grew up in, which is very strange, especially as a psychologist, because you run into your patients everywhere. But in Manhattan, it's the concrete jungle of Manhattan, and you've got the Green Mountains of Vermont. It's a really idyllic, pastoral the pace of life. It's like an oasis. I mean, we're in a bubble away from a lot of the real world that exists out there. So I do find myself hugely grateful and appreciative of being able to live in such a beautiful place. And I miss Manhattan too. I love New York City. I love everything that goes on there. So I mean, one isn't necessarily better than the other. It's just a lifestyle choice, if you're lucky to have that
Yeah.
choice.
Yes, yeah. I saw that you're part of the Psychedelic Society of Vermont. So, are there any interesting projects that you and those folks are working on at the moment? And maybe just if you could connect that to what's happening in Vermont as a state around drug policy or psychedelic research and kind of classifications.
Yeah, absolutely. So I was really lucky to be approached by some healthcare colleagues about a year ago. And I had already created a website at that point for the Psychedelic Society of Vermont, but I hadn't really launched it because I hadn't really reached out and connected with too many people to see how we could launch a psychedelic society here in Vermont. Because I found after I completed my psychedelic training that it's really important to build community. It's really important to build community when you're engaging in this work, whether it's personal use of psychedelics or professional interest in psychedelics. Having a community around you to talk about things and to be transparent and to be accountable and to sort of shepherd this people call renaissance forward. We need to do so in very thoughtful ways. So I was fortunate enough to found the Psychedelic Society of Vermont in June of last year. So it's been about a year, and we're putting on our first annual conference in about a month. Grateful to have Joe and Kyle from Psychedelics Today come join us up here in Vermont. I actually met Kyle here a couple of months ago. He was snowboarding up here, and I wish you could come up here, David. You're certainly invited.
Thank you. I'd love to. Yeah, I used to live in New Zealand, and the mountains there are incredible. I've heard Vermont's quite similar.
Yeah. Yeah, so it's going to be it's sort of in this beautiful the Trapp Family Lodge, which is famous for the sound of music, escaping the Nazis. The family moved here to Vermont and started this lodge, this very famous sort of resort area. So that's where the conference is going to take place, June 20th and 21st, mostly for healthcare professionals, but also all are welcome for the live stream and for the bonfire event that we're going to have. And we've got Natalie Ginsburg from MAPS that's coming, and Lynn Marie Morski's coming from the Psychedelic Medicine Association. We've got Matt Johnson from Johns Hopkins and Chuck Raison from USONA and University of Wisconsin-Madison. Ben Sessa is coming over from England to join us. And we've got Victor Cabral, who just came on as the Director of Policy for Fluence. He's coming. Carolyn Dorson, who's at Rutgers University. She's going to talk about community as medicine. And Franklin King from the Center for Neuroscience of Psychedelics down at Mass General. He's going to come up with his wife and give a presentation as well. So there's going to be a lot of good material. And really the theme is, and I think that's really important for listeners to keep in mind, is that as we usher in this science of psychedelics, there's a huge community outside of the scientific world. There's the spiritual side of things, the spiritual or the human potential, the growth in us as a society, as human beings. So the spiritual side of things is also going to be firmly represented as part of this conference. So really community as medicine, not just psychedelics as research objects and tools to study and dissect and what do they do to the brain and all that kind of stuff. But, what are they doing to us as human beings, and how can we collaborate with spirit and science and bring that all together in one place? So that's really the theme of the conference. So I'm really looking forward to that.
Oh, I think you've sold me, Rick. And you mentioned the bonfire and kind of spirituality being part of it, other than the medical model. And I don't know if you want to tap into this, but for me, the fire is something very powerful. That's something that humans have had a connection with for many, many thousands of years. And there's something about looking into the flames as they dance and as the embers settle down, and it's just those kind of ancient wisdom of the elders held within the embers of the fire as the flames frolicking around settle down. So, and I know other folks that have had ceremonial psychedelic experiences, the fire, really holds space and teaches. So I'd love to hear your experiences of sitting around a fire and connecting with that energy. I'm just wondering, at your summit, what ways of our spirit going to be called in?
Well, I've asked all of the presenters to contain within their talks references or full on explorations of the spiritual side of whatever they might be talking about, whatever their subject is that they'll be presenting to us, not just the cold, hard research that's going on in this area. So we know, for example, Matt Johnson has talked about the mystical experiences a lot. He's written papers about the mystical experience. And I'd love to hear more from him about his experience with that in his research. And the fire, bringing it back to the fire, that's really something for me. I love fire. I'm definitely a fire person when it comes to building fires and sitting around fires, and I love fires. And I think bonfires as both a stabilizing force and a community gathering energy, sitting around a fire has a lot of meaning. And so both collectively or communally and individually, it has a lot of rich meaning, as you were alluding to. So the bonfire really is going to be part of a broader celebration of life. This event is taking place on the summer solstice, so bringing in summer and the longest day of the year here in Vermont, and we'll have dance, the five rhythms dance, like Gabrielle Roth kind of stuff going on inside the tent, and maybe some community circles and things along those lines. It's not totally dialed in exactly the types of events that we're going to have, but the bonfire is definitely a main draw for that. So I'm hoping people will come on up from the local community, from all over Vermont, people coming in from all over New England to come and join us and celebrate life.
Sounds lovely, especially the five rhythms dancing. That's great. I've done that before, and it's a very powerful piece. It sounds a bit like a festival, to be honest, as well as that conference vibe with the lectures and science and research. What's the accommodation situation looking like for this summit?
Well, some people are staying at the lodge. It's the lodge itself. Most of the presenters will be staying at the lodge. Some people have booked rooms at the lodge. A lot of people are coming in for the day, maybe staying, into the evening, but are not coming from too far away, so they can drive home. There are a lot of Airbnbs. So Stowe, Vermont is a well-known resort town. So there's lots of hotels and lots of Airbnbs available for people to stay locally.
So it's not a camping festival then?
No, although I did reserve two campsites that can accommodate 16 people very nearby. So if anybody's looking for a campsite, they can reach out to me, because just in case people are having trouble finding accommodations, I was like, I'm going to reserve these campsites very inexpensively. So it does sound like a festival, but it's really just bringing together these vibes, right? There's lots of stuff going on in this space, and there's lots of beautiful work that's been done for centuries in the realm of changing consciousness, and whether it's ayahuasca or psilocybin, and communing with nature. And this is Vermont, the Green Mountains, so I really wanted to have a heavy emphasis on the non-scientific, non-research side of things, but having the structure and having the substance of a traditional scientific conference is sort of like a backbone to that. And it's kind of a metaphor for how I see this whole field continuing to unfold, is like really embracing the science and the research, and really embracing the indigenous wisdom and the long-standing history. And somehow we need to sort of usher these things both forward harmoniously. And it doesn't always happen, because we witness this fighting and sort of like land grab, and who's better than who, and who needs to be represented here and stuff. And everybody needs to be represented. It all needs to be somehow brought forward in. I'm okay with disagreement and fighting and stuff. It's just as long as we're bringing it forward ultimately in a healthy way.
Yeah, I'm really happy to open this discussion up, Rick, because I come from a similar perspective. So I'm a therapist, and I work it a little bit in the business field as well, in the psychedelic space, and it's a battlefield or a minefield out there, and it's you can't please all the people all the time. And psychedelics today as well is trying to straddle both sides of what seems to be a bit of a divide, between kind of legacy, more traditional, indigenous folks, and those folks that are looking more towards decrim, and those that are just looking for IP and patents and kind of market share. And I like how you're saying that, in a sense, science is maybe that bridge between the two, because science is perhaps pure, and there's empirical nature to it, and so anyone can tap into that science. What you do with it, or how you want to interpret that, into helping people, whether that's in a clinic or a hospital or a treat center, or as a guide, or as that's up to you. It's still just science. It can be interpreted and used in different ways. So yeah, can we just keep riffing on this one, because I think it's really important for people to know that the differences in opinions can remain, but the extrapolation of the more capitalistic model in psychedelics should not come at the expense of folks that have been doing this for a long time, and that there needs to be diversity about what people might want to access, like what is right for you to use psychedelics, what kind of setting, with whom, in a group, or is it it's so important that it's not just one model, and they say, well, the clinical trial says that, and therefore that's what we have to do, and anything that differs from that clinical trial shouldn't be allowed, because clinical trials have been developed very recently in incredibly sanitized and very, very rigid models so that they get the best outcomes. But that's not society, that's not reality in this tight clinical trial model.
Mm-hmm. Right. It's interesting, and it's not to say that that model is wrong. It's just another model, and it has its strengths and its weaknesses. The total contrast to that is, if you think about, from my understanding, I haven't participated in an ayahuasca ceremony myself. I have not. However, I've talked to lots of people that have gone to ayahuasca retreats or gone to the Amazon and had ayahuasca experiences. And we know, for example, this is a different molecule. This is DMT. There isn't a ton of research out there, scientific research on DMT. It's coming along, but this is a substance, this is a molecule, a plant that's been used for God knows how long. And the ceremonies that I've heard of, they're like, you know, 4 or 5 sittings over the course of 7 to 10 days, where you're drinking the ayahuasca brew, every other day for several days. That's not something you see at all in any kind of way in a scientific trial, that people are taking psychedelics every other day over the course of 10 days. What we know from MDMA or from psilocybin is, maybe 3 MDMA sessions over the course of 12 to 16 weeks, or maybe 2 or 3 psilocybin sessions over the course of a certain period of time, but not, what is accepted as a viable model for centuries, if not longer, which is drinking a psychedelic brew, 4, 5, 6 days almost in a row, which is just it's a totally different model, but still, very helpful for people, for spiritual growth, for transformation, for insight, for connection to nature, to ourselves, to other people. A very helpful experience for a lot of people.
Yeah, and coming back to what you were saying before, Rick, by enabling these other models to exist alongside this clinical model, it's creating a bit more space for the spirit to be found and to be experienced. The plants have spirit and we have spirit, and I think one of my fears is, well, what if we just have this sanitized medical model? Is it really going to help people connect with spirit, or to be able to trust that and kind of develop that relationship with that more spiritual part of humanity that we all share? And I feel like that's what the traditional models and structures really help us to connect with, particularly in that group environment. I think there's a very powerful container there for healing, transformation, and safety at times, to be in a group of it, if it's being held in the right way, that space.
Mm-hmm. Mm-hmm. Yeah, there are fears around hyper medicalized, sanitized model, that it's not going to honor and respect the sacred or the spiritual. I know some people don't like the word sacred, the sacred or the spiritual side of things, and yet we know that people are suffering, people are struggling, and if some people, and there are, and you know this, some people feel extremely safe and protected when they are under the direction of an FDA approved, tried and true, apparently, drug that's administered by people who are highly trained and licensed in a familiar brick and mortar office, hospital, whatever type setting. There's a lot of people who put a tremendous amount of trust in that and seek out that level of care, that kind of care, in the face of their own physical or mental suffering. So there are people that are going to gravitate towards that, and there are people who categorically reject that it's all just a sham. This whole FDA approval process is just a sham, and the medical industry is full of conflicts of interest and money and power and influence and all that kind of stuff, and they just reject the medical model altogether. So there needs to be something for everybody, that it's okay to reject the shamanistic ceremonial woo-woo stuff and go for the medical side of things. It's okay to reject the medical side of things and go for the more shamanic, ritualized, and so as long as we're creating structures and acceptance around all these models, then we're really, that's my definition of true inclusivity, I feel.
Yeah. Thanks for sharing that, Rick. And I'm realizing talking to you that the medicine works. Like, we know it works. So these clinical trials aren't saying, are these psilocybin-containing mushrooms, do they work, or even MDMA or LSD? Kind of, we know they work, particularly because of the research from the, 60s and 70s, which was very comprehensive. And such a shame that we lost it, and that we had 50 years of not being able to treat and heal people. So many lives were lost because of the war on drugs. So yeah, we know the medicine works. And I think the question is, how do we design the systems for people to access the medicine? And I'm really, really interested in what Oregon is trying to do. And they haven't quite, got to that stage where they're 100%, made their final recommendations and signed off on it. But it's shaping up to be completely unique globally. I don't think anywhere else is doing what they're proposing. And I think it's really interesting, Rick, because it's not in a medical model per se in how they're doing it. So what have you got any initial thoughts about how it's shaping up over there?
Yeah, I mean, I like what you said about the medicine works. We know it, whether clinical trials prove it or not. We know that these compounds, these molecules, these experiences do. When you say work, we know that they can be tremendously helpful for some people. I don't believe that there's any molecule out there, there's any experience that's going to be the panacea or the thing for all people. I think we share that kind of thing. It works for some people some of the time, and there's so many different variables that go into how that experience might be optimized for it to work for somebody. Because people have sometimes have negative experiences with it, and they would say, nope, it didn't work for me. That kind of thing. So that's, it does bring us back to the Oregon model. One of the things for me, David, that stands out as so interesting is that not only is it not necessarily a medical model, but it's being designed so that people who are just interested in personal growth, you do not have to have a medical or mental health diagnosis to have an experience with psilocybin, a legal experience with psilocybin. And that's fantastic. I mean, we're entering into the world of like preventative medicine and, getting into practices that keep you out of the hospital and prevent you from having. There's a recent study that came out, I think, about those people who report having used psychedelics in their youth are less likely to have mental health problems when they get older. So it's also potentially an act of prevention by giving access to people who aren't depressed, who aren't anxious, who haven't suffered trauma, to give them an experience with psilocybin that might actually prevent them from developing these conditions further on. So that's fascinating. And I think that's really important. And also the fact that the training model that they're developing for what they're calling, I think, facilitators is fairly comprehensive and not burdensome financially, and it's not overly stringent. It gives people a basic structure to know how to hold space for folks who are going through the spirits. It's not, experience. It's not rocket science. So you don't have to have a doctoral degree. You don't have to be a psychiatrist or a medical doctor. You don't even have to have a master's degree. There's people can learn how to hold space for other people with these experiences. So I think that's really wonderful that they've sort of recognized that, and that's how they're designing it. Again, not to say anything disparaging about, again, the medical model. You're a licensed clinical social worker. I'm a licensed clinical psychologist. There's psychiatrists. There's master's level counselors. All types of licensed health professionals who get really good training to be able to be ethical and hold a standard of care in the health or mental health profession. And so they're well suited in some ways to move into the psychedelic space with some additional training to understand what psychedelics are all about. But it's not a requirement. And I think that any institution that insists that having a licensed health practitioner, I think, to hold space for people. I mean, I can understand from a patient safety perspective, but also a patient preference perspective, right? What I was saying before is that there's a lot of people that prefer to be seen by a licensed provider, not somebody who's unlicensed. It doesn't make one better than the other. We have to look at what do people want. Some people want the facilitator who is trained in this Oregon model when it goes online. Some people want the license. They want a psychiatrist. They want the top of the top, licensed person that you can get. And other people are more flexible. So we have to be able to accommodate everybody.
Beautiful. It's really powerful hearing you say that, Rick. All the money that you've spent getting your degrees. And I relate to that. At the same time, we're recognizing not everyone needs that. There are definitely situations where you need someone who is trained and experienced with psychiatry and psychology, for sure. That there are definitely those pieces. But Oregon's going to have this screening assessment process that will help to say this person probably might need to go down that path, and that recommendation will be made if they are approved. But that really, I love the point you're saying as well about people don't need a diagnosis to use psilocybin in Oregon with what they're proposing. Mm-hmm. They just simply need to have a calling and a sense that I think it will help me. I think I will benefit from it, or I think I need it, or I want to see what it's like, and then figure out how to make sense of it, and do that with an integration group, or with a therapist, or with my priest or rabbi, whatever it might be, or wife or husband, to make sense of it. So it just loosens it up a little bit. That tension that we have, that it's got to be done in this way, it just loosens it up. And so it's an experiment for sure, and we're not sure what's going to happen there. Mm-hmm. But there's a piece around Carl Hart's work around cognitive liberty as well, that it frees up people to access this medicine in a safe way. It's still a safe container, but to do so without having to be diagnosed, because a lot of our clients, I'm sure, get to that cliff face, and as they're teetering on the edge of the cliff, they're suicidal, they're overdosing, they're having panic attacks, or they've got acute chronic PTSD. Mm-hmm. Then we start to work with them. Oh, okay, yeah, come into my practice, I see you once a week. But what if we'd started working with them 5 years before, or 10 years before? Mm-hmm. It's amazing. So in your practice as a psychologist, can you paint a picture about what does a psychologist do? And definitely in relation to, say, what a therapist or a psychiatrist does.
Well, yeah. I mean, just to go back to what you're saying before for a second, there's also this. You saw
that's quite a jump. I know
this movement, the right to try. There's something that just came out recently that I read about the right to try. So along the lines of cognitive liberty, and along the lines of decriminalization or legalization. there is this idea that we do have authority over our own bodies and choices and our own minds. And if we want to try a substance, we should have the right to do that without fear of being incarcerated. So I am a believer in right to try, and I forget what the legislation is that's coming up now about that. It's either a federal legislation or it's located down the Washington D.C. area, Virginia or something. I'm not really sure, but there's the
Yeah,
right.
I think that's the work that Catherine Tucker's involved with. Yeah.
Okay, yeah, I think so. Yep, yep. So yeah, and going back even further, Vermont is on the cusp of passing a statewide decriminalization law that's going to hopefully go into effect later this year if the governor signs it, which is a massive decriminalization effort. All drugs, decriminalizing cocaine, small amounts of cocaine, heroin, psychedelics, all that. So I think that's really fantastic if the governor signs it into law. Does decriminalization go far enough? Carl Hart would argue no, it doesn't go far enough. And I tend to lean in that direction as well. But I think it's a step in the right direction to decriminalize things so people aren't terrified of being. I myself had legal problems when I was active in my addiction as a youth around alcohol and psychedelics. So I think that decriminalizing is, from a personal experience standpoint, I think is really important step in the right direction. So, but as a psychologist, well, you're a licensed clinical social worker. So in some ways, a psychologist is no different than any other mental health worker, somebody who does talk therapy, 45, 55-minute sessions, using different models, cognitive behavioral therapy, acceptance and commitment therapy, internal family systems, doing trauma work, doing EMDR, doing any type of psychoanalytic work, psychodynamic kinds of whatever someone's training and however they work, just a regular talk therapy thing. A psychologist typically is somebody who has more training, so they might do more types of assessments or diagnostic processes, like psychological testing, for example, personality testing, cognitive functioning types of testing. And sometimes clinical psychologists with a doctoral degree may be employed in hospital settings, working with more severe patients, people with more severe and persistent mental health conditions. And one of the things I think we talked about earlier before going live here, going on recording, was there's a movement in psychology that has been around for 20 years for certain psychologists with a doctoral degree in psychology and then a master's degree in pharmacology, psychopharmacology, with supervision to be able to prescribe and deprescribe psychiatric medications. So there are what's called prescribing psychologists in 5 states. And Vermont has been trying to pass a law now for several years to allow psychologists with this type of advanced training to prescribe and deprescribe psychiatric medications. And I personally believe when it comes to psychedelics, this is perfect, to be able to have a psychologist who's trained in psychedelic therapy, who's trained in mental health and diagnosis and treatment, but also who's rigorously trained in psychopharmacology and basic clinical medicine, to be able to be part of a healthcare team that prescribes or deprescribes psychiatric medications, psychedelic treatments, is really important to help the workforce out, because we're basically in a massive psychiatric workforce shortage. Can't find a psychiatrist to, unless you want to wait 6 months on a waiting list. So anything we can do to help expand the workforce is an important one. So I've been fighting that fight for a long time. It's not very popular among psychiatrists, but we try.
Yeah, psychiatrists have a very cushy deal. That they are back to back with those 6-month wait lists, charging $500 for half an hour session, something like that. So of course they do want healing to be more widespread, but at the same time I do feel like psychologists are in a better place, definitely for psychedelics, to be able to understand how to work with people, because it's not just about the medicine and the kind of chemical compositions and the molecule and the neurotransmitters. There is that piece to it, but it's more that clinical psychology of, and particularly depth psychology, perhaps, to really help people understand what happens for them in that moment that they're, say, working through something that's coming up, and how to make sense of that. I would rather have a psychologist and a psychiatrist to meet too. And so yeah, what do you feel like could happen if psychologists that meet that criteria that you said, which is still pretty extensive, criteria that you put out there for a psychologist to prescribe, what kind of impact would it have? Do you have a sense of the numbers of in America or in Vermont that would then be able to prescribe?
That's a
I
good
don't know if
question.
anyone's done any data on that.
Yeah, it's an argument against prescribing psychologists, that there aren't going to be that many people that are willing to pursue the rigorousness of the training and the education that's required to prescribe. But I would say that we can look at two things. One is we look at psychiatric nurse practitioners. They fought for a long time to get prescriptive authority. And as far as I'm concerned, psychiatric nurse practitioners are making a huge difference in terms of access to care and quality care. Psychiatric nurse practitioners can handle psychiatric medications, can work with patients, and be helpful in that way, prescribing and deprescribing. So we have a model where once the laws change and this new profession is endorsed and supported, then we will have an expansion of the workforce, but it's going to take time. So there's something like over 200 prescribing psychologists in the country right now, but it's been we've been fighting for a long, long time, and the fight is real to keep the numbers low and to stop legislation from passing in other states. And that's a real challenge. But the other thing is that even if the numbers are low, David, in the state of Vermont, if you get one additional psychiatrist to serve an area, that's a huge, huge win for that area. One psychiatrist to prescribe or deprescribe medications for a whole bunch of people in the community who are currently not being served is huge. So if we pass a law in Vermont and we have one prescribing psychologist, two prescribing psychologists, three prescribing psychologists, that may not seem like a lot of prescribing psychologists, but the need that gets met in terms of deprescribing or prescribing psychiatric medications and providing psychotherapy at the same time, not just writing scripts and in 10 minutes and having them in and out the door, but really spending time with people. That is a huge win. Just one, two, three additional people on the workforce is huge. So I think the numbers will increase over time, but even just a few additional people to help with this massive need is hugely important. So
That's a really good point. So maybe there should be special compensation for states and counties where there's, it's very rural, underpopulated, and there's just no one else there within a 50-mile radius.
yeah.
And it speaks to as well telehealth as well. So the capacity to in rural areas, to use telehealth for those appointments.
Yeah.
And so I think psychedelics are starting to make legislators, insurance companies, health systems think about these tricky questions that they really never thought about before, because psychedelics are so different and they don't fit snugly inside that model. They're a square trying to fit inside a circle.
Yeah.
So people are having to ask these questions about, well, why do we have these rigid ideas of what's a psychologist, what's a psychiatrist, what's a nurse practitioner? And for me, it comes down to training as well. So maybe if we can talk about the training piece. So what would be a really good way for a system, a healthcare system, kind of higher education system, to really scale out training so that people that are going to be a doctor, nurse practitioner, or a nurse, or a psychologist, or a licensed therapist, so that they could be competent to work with psychedelics in whatever setting it might be. So like how do we make this happen so that the crisis that we currently have around mental health and addiction and loneliness, and how can we be able to, say, in 5-10 years have psychedelics become part of this system for people that want to access it, I wonder.
Yeah, I mean, the key word there, David, that you just used was competent. It's a question of competence. It's not a question of what school did you go to, how many years did you go to that school, what particular track did you follow? What niche did you pursue in that sort of silo oriented kind of way? This is about broad competence. Psychedelics are great disruptors, and it calls on all of us to sort of take a look at the systems that we take for granted and just blow them up. Great disruptor, blow it up and sort of see what really matters. And what matters, I think, in this space more than anything is competence. If we're gonna redesign things, or we're gonna re-engineer the workforce as it comes to healthcare delivery, as it comes to psychedelics, then we really need to look at, from high school, undergraduate, graduate school, is there a broad-based competency model that can be designed so that you get basic biology, chemistry, physics, basic pathophysiology, clinical medicine, basic mental health counseling, basic nursing, basic understanding of the human body, the human mind, the human psyche, social systems. I mean, social, bringing in the tenets of social work. Can we redesign a more competency based model rather than a knowledge based, like, this is my knowledge, this is my training over here? No, we can train people to have this broad base of competency and be much better suited to be sort of general practitioners in all domains rather than this sort of hyper focused kind of way. That's a bit of a pipe dream. I understand that, but that's kind of what we're talking about here, is that can we move things in a more community oriented kind of way rather than a silo, this is my specialty only kind of way, stay in your lane kind of mentality, which isn't really helpful here.
Yeah, and I read about a month or so ago that 3 universities in America are joining forces to develop a psychiatry psychedelic training program. So I think that's a really good statement. I can't remember who they were exactly, so I won't try and butcher it. But for example, what Rachel Yehuda's doing, at Mount Sinai is phenomenal work, and I feel like more of those organizations that are big, that people trust, that can say, we need to do this, not just because we want to do the research and get IP and pieces like that, and then philanthropy money, but these are skills that we need to teach a huge amount of people. So yeah, I think social workers and nurses are a really big part of that moving forwards. I want to move tracks because we definitely have to speak about addiction and recovery from a multiple levels. So you've mentioned being in recovery on a personal level, and then I'd also like for us to talk about addiction, both what we are seeing on the front lines and how psychedelic medicine might offer a new treatment modality there. So perhaps starting personally speaking, Rick, to whatever extent you feel comfortable about your experiences of substance use, addiction and recovery, just to kind of, and then move into perhaps have psychedelics played a role in that journey.
Yeah, I'm happy to talk about it. I've spoken publicly about my own personal story of addiction and recovery in the past. I'm comfortable talking about it. And it's interesting, just my experience being somebody who sort of crashed and burned with an unhealthy relationship to alcohol and drugs at a young age. I started using tobacco and nicotine at the age of 10, and then cannabis at the age of 11. I'm sorry, alcohol at the age of 11, cannabis at the age of 12. By the time I was 15, I had done LSD, cocaine, MDMA, and was a regular smoker of cigarettes at that point, a daily user of cannabis at that point. Wanted to be a daily user of alcohol at that point, but gradually just became more and more habituated to and entrenched in a lifestyle of drinking and using drugs. And one of those drugs was psychedelics. I used a lot of LSD in my active addiction. I was somebody who found that initially when I started taking LSD, I didn't want to take any other drugs with it because I wanted the pure spiritual experience of taking LSD as a 15, a 16-year-old. But eventually I found that I couldn't handle taking LSD without having large amounts of cannabis and alcohol at my disposal. And I learned that because I loved alcohol so much, if I took a half of tab of LSD on a daily basis, I could drink a lot more on a daily basis because the LSD helped me stay a little bit more alert. And I could consume a lot more alcohol. Some people do that with cocaine. They realize if they do a few lines of cocaine, they can drink a lot more. And so I ended up crashing and burning on alcohol with acute pancreatitis by the time I was 20 years old. But what's interesting to me is that I had several profound experiences with LSD when I was a kid. And when I crashed and burned on alcohol and wound up in a 12-step rehab, the Hazelden Foundation, I I quickly recognized that my experiences with LSD made me extremely receptive to the message that was being put forth to me in a 12-step oriented rehab program. So concepts like surrender and a connection to spirituality, a connection to open-mindedness, willingness, being honest with oneself, taking one's inventory, these kinds of concepts that are so common in 12-step programs and 12-step, they resonated so strongly with me because of my experiences with LSD. So it was really kind of like an easy an easy process for me to um, discover that there's real power in recovery. And I'm grateful that I've been able to stay in recovery for almost three decades now, 30 years. And I credit my experience with LSD in my active addiction with enabling me to be receptive to the message of recovery that I've lived for this long. So that's kind of my story in a nutshell.
Thanks for sharing that, Rick. And that perspective about LSD, in a sense, you had already started your recovery while you were still in active use. So those messages and what you were trying to do there. And I know the story of Bill Wilson, so the founder of 12 Steps, and some people have said there's a 13th step, that was cut out, but that, he had used LSD for his own addiction, and obviously the work of Stan Groff using LSD for alcohol addiction, amongst other indications, way back. There's some very promising research there. So yeah, I mean, maybe what are your thoughts about some of the research that we're seeing now around addiction and treatment? So that could be the Mydocin and smoking cessation, or Awaken and ketamine and alcohol, or there's plenty of other companies out there. Maybe just more generally, do you sense that your experience of using psychedelics, particularly for addiction, that transformational potential, the healing potential of recovery, there's something really particularly powerful and profound with psychedelics, that there's a word in Yiddish, mamash dafka, kind of specifically matches that, like it couples there, almost like a receptor, like it really does. So what are your thoughts there, just more generally around psychedelics and addiction?
Well, yeah, one thing that we know, like for example, with the history of Alcoholics Anonymous, believe it or not, Carl Jung, a famous psychiatrist, people know Carl Jung, Jungian therapy. Carl Jung is well known in AA to have provided some really important information for Bill Wilson and for the program. It's actually written into the AA literature that that Carl Jung was suggesting the only real way for people to recover from severe alcoholism is to have a vital spiritual experience, to have huge emotional, psychological displacements, that their ego, that their whole orientation towards themselves and the world is totally displaced. And what takes place of that process of setting the old stuff aside is that whole new set of concepts and understanding and beliefs come in and supplant themselves in order to facilitate or foster a recovery from alcoholism. So Carl Jung, having that as a model, and having that as a backdrop to bringing it to psychedelics, is that psychedelics are the great disruptors, right? This whole idea about the default mode network of being quieted down so that there's more interconnections between various parts of the brain. There's different ways in which the brain is communicating as a result of the psychedelics. So there's a big shakeup. Michael Pollan uses the snow globe analogy in his book and his talks, that you take a psychedelic and the whole snow globe is shaken up, and things settle back down potentially in a different way. There's new connections that have been made. And I think that's the real hope and the real promise, that for some people, having a profound psychedelic experience can really disrupt some deep-seated ideas about themselves, their relationship to alcohol, drugs, their relationships to people, their relationship to themselves, disrupt them so much that they realize that in a way that wouldn't have been possible, that alcohol is really killing them, that their heroin addiction is really not what they are interested in, they want to do anymore, that their reliance on cocaine is something that becomes disgusting to them because they've seen this other way of they've experienced another way of seeing themselves. So that's my hope and my understanding in the effectiveness of psychedelics to treat addictions. Is really it really jolts people out of these really negative self-destructive patterns, but instead of just disrupting them and then you know hoping that that's it. It comes with a sense of meaning. It comes with a sense of purpose. It comes with a sense of heart opening and connection to themselves and to other people in ways that alcohol or drug use or other addictions don't seem that appealing anymore because they see things so differently. And you mentioned Mydicine is a company that I have an advisory board role with, and they have partnered with Johns Hopkins in this multi-site clinical trial to use a psilocybin compound to treat tobacco use disorder for smoking cessation, nicotine cessation. And that's just to try to replicate on a broad scale what Matt Johnson and his team have already shown in research to help with tobacco cessation using psilocybin. But we've seen psilocybin in trials for cocaine use disorder. You mentioned Imperial College or University of Exeter and Awaken Life Sciences, their recent clinical trial using ketamine for alcohol use disorder. Ben Sessa and his group have published work on using MDMA for alcohol use disorder. LSD, as you mentioned, has been used, previously, many trials to treat alcohol use disorder. So, I mean, I think addiction, because it's such a devastating, devastating condition, whether it's sex addiction, food addiction, gambling addiction, substance use disorders, it's so devastating in so many different ways that any tools that can be developed to make a difference is a huge win for society, for individuals, for families. So I'm really excited. I'm particularly really excited about the research being done in the addiction world with psychedelics. It's really, really promising.
Beautiful. I really appreciate that. Yeah, me too. I feel so passionate about where this could go compared to where we have been for the last 50 years, which is really low outcomes, sorry, like 10 to 15% after 12 months, remission rates for someone that's coming out of detox, say, really, really low. So there's a huge ground to make up there. And even something like smoking, that kills more people than opioids every year. And, so I think if that work could go forward, it's really fantastic. And a piece that you said, Rick, was about, I think, heart connection. It's not just about receptors here. There's something about psychedelics that kind of flips over the script and gives a person a deeper kind of look into themselves. And it comes from more of that heart space with forgiveness and compassion. And particularly when we're talking about trauma, just how crucial that is. And with, I would say 99% of people that develop an addiction have trauma down there, and so just methadone, Suboxone isn't really going to heal that, whereas psychedelics are much more likely to give that opportunity to tap into that. So what are your understandings of how trauma fits in with the psychedelic healing potential for people with substance use disorders in particular?
Yeah. I just posted something on LinkedIn recently, just a quick little video clip about this concept that I really believe in and see all the time. Whether it's a big T trauma, like massive, complex, and repeated trauma, or just little traumas along the way in one's development, little minor, seemingly minor traumas. I believe that most people with addictive disorders, and arguably a lot of people in general, whether you have addictive disorder or not, have experienced some kind of loss, disappointment, letdown, or pain associated with somebody important to them not being there for them when they needed them. So you think of a small child who expects their father to show up to their baseball game, or their mother that yells at them for getting a B and not an A on their report card, or types of neglect, or types of things where a young person looks to their sibling, to their friend group, to their parent for support, for guidance, for trust, and that somehow that trust gets shattered because that person who's so important to them says something that's so devastating. And maybe this happens repeatedly. And then imagine at the same time that person discovers a cigarette, and they have this experience where they're like, oh, well, this is interesting. And they develop a relationship with that nicotine, that they know that is a reliable resource. Now, people are no longer to be trusted, but I've got this porn magazine that I can go to whenever I want, and that's going to soothe me. Or I've got this alcohol that I can always turn to that's going to give me that sense of connection and trust in whatever I think this is that I'm trusting, because people are not to be trusted. The world is not to be trusted. So then you introduce psychedelics, maybe that reopen this critical period of vulnerability and an openness to begin to be willing to trust the world of people again, to trust another person. Maybe it's trust the guide or the integration coach or the therapist, or trust their companion, or trust their dog, or trust the nature, that something other than this self-destructive tool that they've relied on is something they can trust again, and begin to heal from that trauma. So I think that's where psychedelics come in, particularly with MDMA and trauma, complex PTSD, because it's such a heart-opening kind of experience, and people can revisit the trauma with a sense of calmness, and a sense of like you said, forgiveness and compassion that otherwise was not accessible. And they can learn to trust themselves, trust people, trust the world again. And they can begin to distrust the alcohol, distrust the gambling, distrust the porn, because they realize that actually isn't working, and it's okay to trust people again, or whatever. So I believe that that's a really important part of psychedelics.
Wonderful. Really appreciate that. And one thing that you said that I want to just focus on is the small t traumas. And something I found in my own psychedelic experiences, and have heard from others, in a psychedelic space, memories can come back that, like, oh, I didn't know that was a big deal. Wow, that really hurt my feelings. When I didn't get invited to the party, or when, I got dumped by that girlfriend. I didn't know that had hurt me so much. Or when my dad forgot about this thing that was supposed to happen, and that's real. I'm speaking personal experience. So, these things just come up. It's like, shit, I was only 5, or that I just didn't know that was still in my memory. Like, how's that there? But it comes up, and it might be that was the first moment it happened, or it was maybe the last straw, because other things had happened before. Mm-hmm. But these little traumas that happen, we soak them up, like our brain, our body, our soul, who knows where they get soaked, but they're there. And we rush around so much, we often don't have time to think back on kind of the arc of our life. And psychedelics enable us to kind of do that, to look back. And in a sense, that's why they can be so helpful to come to terms with our mortality, and why they can be useful, in these clinical trials for people that have, end of life illnesses, or that have, depression and anxiety because of cancer diagnoses. They have this acceptance about the way that life is. I can't change the past, but I can come to terms with it and love myself, and feel okay with, or more okay with how life is.
Mm-hmm. Yeah. One of the interesting tropes that we hear in the psychedelic world is that, and this is controversial, and I'm going to be a little bit defiant or irreverent here, but that is that we often hear people say taking psychedelics is like 5 years of therapy in 8 hours. And that always bothers me when I hear that, because on the one hand, it's true that psychedelics can bring into awareness, in a way that nothing else can, the kinds of conflicts and difficulties and challenges that we carry around with us, that we didn't even know we carried around with us. And it can be very powerful and very meaningful in a very short period of time. But I'm also biased, and maybe you share this bias, is that, when you work with people in your office as a clinician, as a mental health counselor, if you feel good about what you do, and you get good feedback from your patients, we have the ability to instill a sense of trust with our patients, and they can begin to trust themselves and to trust the therapist, and to review some of these old hurts and really get into it over the course of therapy in a way that's very healing. So it can happen with therapy. And I don't think one is necessarily a substitute for the other. I think they work very well together. Psychedelics are yet another tool, just like therapy is a tool, just like AA is a tool, just like Suboxone and Methadone are tools. They're all tools. And it's really important to respect and honor that each one brings something positive to potentially for an individual. And all of them have their drawbacks too. We know, for example, that people can go down to Mexico and have an ibogaine experience to overcome their heroin addiction or their opioid addiction, and they can leave Mexico and go back home and relapse and overdose and die, even though they've had this powerful ibogaine experience. So it's not curative. There's so many other things that go into it, just like there's so many things that go into therapy. There's so many things that go into attending 12-step meetings that have nothing to do with attending 12-step meetings. You still have to do the work in your daily life. So psychedelics give us an opportunity to experience ourselves and the world in new ways that we never thought possible, and unearth some things and address some things that we didn't think we could, that we knew were even there. But we still have to sort of integrate those things into our daily lives and continue to do the work.
Yeah. Thanks, Rick. And that assisted word, it's very like neutral and boring in psychedelic assisted therapy, but for me it's like, oh wow, it really clicked. That's where the magic happens, in the assisted piece. And so I think of it like psychedelic assisted life. So what's life? It's kind of everything. It's everything that happens after psychedelics. So, and it's not a magic pill. It needs a lot of work. And I think I also am irreverent like you, brother, that this one pill is like, or one session is like 5 years of therapy. I think that's just marketing bullshit, to be honest. It's not fair. It puts pressure on people to have a breakthrough, eureka moment. Oh, I'm healed. I'm wonderful. Life's going to be great. That's fucking bollocks. It's not real. And it takes a lot of hard work. And the assisted therapy piece, the assisted life piece happens over the rest of life to do that. And yes, psychedelics are a part of it, but, we can't rely on psychedelics. Otherwise, it's switching another addiction, and it's just part of life revealing itself. So yeah, I'm feeling that irreverence inside of me as well, Rick. Thanks for stoking that one up.
Yeah, sure. Yeah,
so we're top of the hour. Yeah. Go ahead, mate.
It's just the assisted part can't be emphasized enough, that psychedelics or therapy or 12 steps can provide messages or tools to help us, but it's really in the like, what foods am I putting in my body? Am I practicing any kind of meditation routine? Do I have an exercise regimen that I follow? Who am I hanging out with? What's my community like? What are my social networks like? Do I connect with nature at all? What books am I reading? What music am I listening to? I mean, the list goes on and on and on. And that, an AA program, a harm reduction program, a therapy program, a psychedelic program, a meditation retreat, all these things provide a nudge, and potentially a very transformative nudge in the direction of like, okay, and then what? What are you doing in your daily life? And there's so many different ways that we can improve our lives and make little changes here and there. And I just listed off a whole bunch of them. So that assisted part it's not just assisted by a therapist. It's not just assisted by a drug. It's not just assisted by a shaman or an integration coach. It's assisted by like everything. We need a lot of assistance. We need a lot of tools to keep us on a healthy track.
Beautiful. Yeah. And I love how you're including, 12 steps and behavioral activation, exercise, the community that we're in, the jobs, with the music we listen to. It's all part of that process. And I had 3 days a month or two ago where I stopped listening to drum and bass music, like an electronic dance music, very fast and intense, and I stopped drinking coffee, and it was amazing, but I just couldn't do it. Like I just need that fast-paced, intense drum and bass coffee. But for those 3 days it was something beautiful. And there's something with addiction and psychedelics that really necessitates embracing change and transformation and saying, hey, let go of that idea of who you are, and because a lot of that might be like you don't like yourself or love yourself, or you're acting and you feel like kind of trapped in this life that doesn't feel right. So just loosen that, and it's great to play around. And you mentioned kind of sometimes you grow your beard and sometimes you let it, you cut it back, and just to change it up a wee bit. It's so good to change things up, like what we wear, the music we listen to, and it's refreshing, isn't it?
Yes, yeah. So many people are resistant to change, but if you play around with it and you can see it as something fun, it's actually a really healthy thing.
Yeah. All right, Rick, this has been just such a delight. If you would like to just tell our audience any other bits and bobs about yourself, where they can find you, if they want to find out more, and also just remind them about this summit that you're planning in Vermont this summer, the details there.
Yeah, I mean, I appreciated what you said at the beginning, David, about how I come across, over social media, because I love to produce content, put stuff out there, anything that strikes, inspires me to post stuff. And you said that, I seem to be very authentic and natural. So I hope to continue to convey that. I think sometimes social media can be a little bit of a minefield as well. And, some people, they just see the name Dr. So-and-so, and they just think I'm part of the establishment, and they want to target, the establishment, and I'm part of that. Or some people have struggled with 12-step programs, and I'll say something about positive about a 12-step program, and they're like, no, AA murders people, it's a cult, and they'll get after me for that. But I do try to hear all sides, and I'm okay with that. And I really try to be authentic and heart centered as much as I can, as much as I can be intellectual in my head. A lot of times, I really try to present and offer value. So people can find me on Twitter. I'm very active on Twitter, on LinkedIn. And the conference this summer is just going to be amazing. So anybody who's in the New England area or wants to come to Vermont, there's a few tickets left. We've got some great speakers. It's going to be a good evening celebration right around the solstice, June 20th and 21st in Stowe, Vermont. And that's at vermontpsychedelic.org. It's vermontpsychedelic.org. You can find all the information there. And this has really been awesome to be on. I can't believe I'm on Psychedelics today. It's really an honor, a privilege. I love what you guys do, and I've been following you guys for a long time. 3 million downloads recently. I mean, that's awesome. It's totally awesome.
Thank you. Yeah, cheers, Rick. Joe and Carl have been very busy over the years, and I really respect what they've created, and it's a great platform, great message we put out, just for spanning the sides of the audience that we've got here that are interested in the future of where psychedelics may go. So I've loved the chat with you, Rick, and we'll go back to connecting virtually. Yeah. Been a real pleasure. Have a lovely day.
Thank you so much, David.